Hip and elbow dysplasia are major orthopedic developmental disorders which usually affect large breed dogs. But what do they really mean? And what are their health implications on large breed dogs in general? During the course of this video, I'm going to be looking at hip and elbow dysplasia and their health implications on large breed dogs, including how they can be prevented. If you're turning on this channel for this first time, please, I want you to kindly subscribe, leave us a like, and say something nice in the comment section. So let's go back to our discussion. So for starters, hip dysplasia usually affects the hip joints, right? Where the ball, that is the femoral head of the thigh bone, doesn't fit in properly into the socket of the pelvis. For those of us who did biology, we understand how the bones in the body work. So hip dysplasia is basically when the ball, the femoral head of the thigh bone, doesn't fit in properly into the pelvis. The pelvis here is probably the waist region, very likely. So that's where hip dysplasia usually affects. Now, when this happens, it usually causes excessive movements, cartilage damage, inflammation, and osteoarthritis over time. So as time goes on, this particular dog is going to suffer from arthritis, right? So hip dysplasia is polygenetic. That means that it does not have one particular cause. This means hip dysplasia could be caused by a whole lot of genetic reasons. It is also caused or influenced by environmental factors, right? Sometimes dogs engage in activities like rough playing, jumping, running, especially when they are in a very tender age. And sometimes when dog eats excessively and when dog grows up real quick, it usually leads to hip dysplasia. So that's hip dysplasia. Now we're going to be moving over to elbow dysplasia. So basically, elbow dysplasia is an umbrella term. So elbow dysplasia does not refer to one particular disorder. It is an umbrella term that covers a wide range of abnormalities that usually affect the elbows of dogs, right? Now, these abnormalities include things like fragmented coronal process, ununited anconal process, joint incongruity, that means mismatched bone surface, right? So, like hip dysplasia, it results in instability, pain, and progressive arthritis, just like the way hip dysplasia causes instability. Now, when joints or elbow dysplasia affects dogs, it makes it difficult for them to move properly. And in the long run, this leads to arthritis, right? So, like hip dysplasia, elbow dysplasia is also hereditary. It's inherited, right? It's inherited. But this could be exacerbated when a dog engages in intense exercise, right? Like when people take their dog for running or for jogging or the dogs jump, especially when the dog is very young. Maybe this dog is from like 1 month to 5 months or 6 months, and this dog engage in a lot of high intensity activities. It could actually lead to joints or elbow dysplasia, right? So this is the elbow for dogs. When your dog move, this particular part of the body is what they call the elbow. As for the hip affects their waist. So we should know the difference. Elbow dysplasia affects the elbow of dogs, while hip dysplasia affect the hip of dogs, right? So basically, the both of them have the same impacts. They cause the same kind of damage on dogs, which is limited movement, they don't move well, arthritis, pain, and sometimes this could also lead to depression too. Yes, at times when this happens for a very long period of time, these dogs are unable to move, they get depressed. So that is what elbow dysplasia is all about. But what are the health implications of hip and elbow dysplasia in large breed dogs? Let's look at them. So if you have a large breed dog, there is a high possibility that your dog could have hip and elbow dysplasia, right? Because of the way they are built. Rottweilers, Brabos, Cane Corsos, German Shepherds, all these dogs are very likely to have hip and elbow dysplasia. Now, this is also as a result of the fact that these dogs grow very quickly as pups. In some cases, they gain 2 to 5 pounds per week very quickly, and all of this is impacting on the hip and able of these dogs. And also, genetic too is also one major factor that leads to hip and ankle dysplasia, right? Genetics. That's why it's advised that when people are breeding, they should do proper investigation. Although we are going to be talking about that later on during the course of this video. So let's look at some of the health implications of hip and ankle dysplasia on large breed dogs. Firstly, hip and ankle dysplasia leads to pain and lameness. This dog suffers excessive pain. He's no longer interested in going out on walks. He's no longer interested in playing cash. He's just staying at a particular place. And sometimes the hip gets stiff. The hip of this dog gets stiff. He finds it practically difficult to move. This is one of the major effects of hip and elbow dysplasia, right? And it reduces mobility. It also leads to low quality of life. This dog is no longer happy. He's just staying at a particular place. It doesn't engage in the activities that it usually engage in, you know. So these are some of the health implications. Also, it also leads to osteoarthritis, which causes joint instability, remodeling, and inflammation, cartilage erosion, leading to permanent arthritis. You know, so this thing is very, very devastating for dogs, especially large breed dogs, because arthritis, they find it difficult to move, right? So these are some of the health implications of hip and elbow dysplasia for large breed dogs. Now, how can it be prevented? How can it be prevented? So basically, hip and elbow dysplasia cannot be completely prevented. You cannot really write it off, but there are things that you can do. There are basic things you can do to ensure that you keep hip and elbow dysplasia away from your farm. Number one, breed only certified dogs. If you're going to breed your male, you have to ensure that your dog has been certified that it is free from hip and elbow dysplasia. If you're going to breed your male to a female, you have to be sure that the female you're breeding your male to has been certified and has been confirmed to be free from hip and elbow dysplasia. That's one thing that you can do, right? Ehen. So this certification usually comes from VIOAF pen or other equivalent of radiographs taken usually at 2 years of age. So for you to be really, really sure that this thing is not there, you go for radiography. You take a radiograph of your dog at 2 years of age, right? Or 2 years and above. Avoid breeding dogs that are already affected with hip and elbow dysplasia, like I said, because this is inherited or hereditary, right? So, as a result of recent research, they said 20 to 50% of precanine genetic research has shown that dogs bred to dogs that have hip and ankle dysplasia are very likely to have offsprings that also suffer from hip and ankle dysplasia. So you have to be very, very careful. Another thing that you can do to prevent hip and ankle dysplasia from knocking on your door is nutrition, right? Nutrition and food management, especially if you have large breed dogs. You're expected to monitor the amount of food you give to your dogs. Your puppies should not eat to the point whereby they become overweight and they start playing and jumping. And this thing is going to, in the long run, have impact on their joints and elbow, right? And you don't want any of this thing happening to your dog. So you're expected to monitor the amount of food you give to your dog, right? You're expected to provide for your dog controlled calcium. It should range from like 0.8 to 1.2% of calcium. Monitor the amount of calcium you're giving to your dog. Phosphorus and energy levels to prevent rapid growth. So you should monitor the amount of calcium your dogs take, the amount of phosphorus your dog take, right? And the amount of what they call it, carbohydrates that is in the food. so that you're going to be able to avoid rapid growth in your dog, right? So their brand formulated for dogs, right? Maybe all these canned food and things like that, that usually contain glucosamates. This support joint growth. So when you're feeding your dog, you're expected to provide maybe supplements, right? This supplement that contains glucosamate, it helps in um, joint growth. Now, another thing you could also do is exercise and weight control. Now, when you're exercising your large breed dog, you're expected to exercise your dog in a way that limits high intensity activities. You should try limiting jumping and rough playing until this dog is like 12 to 18 months. I'm not saying your dog should not jump or your dog should not play. Your dog should play because it's very important, but it should be limited, especially when the dog is not up to a year. So if the dog has gotten to 12 months or 18 months, good and fine. Because by this age, the growth plate has closed. That means their bones has fully developed. They won't have any issue with um, hip and elbow dysplasia. So these are some things that could be done. Early intervention and supplement. If you notice a kind of disorder in the hip of your dog, intervene immediately by taking your dog to the veterinarian. If there is a surgery that the veterinarian can conduct to help put the joints and the elbow back on track, to be good and fine. Also give your dog supplement that contain glucosamates, right? And also calcium too. This is going to help their, what's it called? Their hip and their elbow. It's important for you to schedule regular vet visits. Your veterinarian, your veterinary doctor's office should be like your second home, especially when your dog is young, right? You should be visiting your dog regularly for routine checks to check the bones, check the elbow, to know how they are doing, right? So you should also consider giving them supplements that contain omega, MSM, right, from puppyhood. So the bottom line from today's video is this. Hip and elbow dysplasia is almost guaranteed for a large breed dog. It's almost guaranteed if you have a large breed dog, especially the Rottweiler or the Boabo or the Cane Corso. All of these dogs are high risk. There's a high possibility that they can come down with hip and elbow dysplasia, right? But if you take certain preventive measures, especially before breeding, ensure that the dog you're going to breed has been certified. Ensure that the dog you're adopting too, for those persons who love to adopt, ensure that the dogs you're adopting has been certified to be free from hip and elbow dysplasia, right? Provide your dog supplements that contain omega. Provide your dog brand that contain glucosamine. All these things will help your dog. Limit excessive exercise for your dog, right? By so doing, you're going to keep hip and elbow dysplasia away from your large breed dogs. So if anything that have been discussed so far in this video resonates with you, please, I want you to kindly subscribe to this channel, hit on the notification bell, say something nice in the comments, and give us a like. And we are going to see you guys on the next episode. Thanks for sticking around.